Hi, I am Yogi. Today's topic, technical topic is uh, minimum valid criteria. Now, one of the fundamental principle of adverse event reporting is the determination of constituents and individual case safety reports during the triage phase of a potential adverse events reports. It is important to determine if the four elements of a valid individual case safety reports are unidentifiable patient, unidentifiable reporter, unsuspect drug, adverse at least one adverse event. If one or more of these four elements is missing, the case is not a valid individual case safety report. Throughout, there are no exception to this rule. There may be circumstances that may require a judgment call. The term identifiable may not always be clear-cut. If a physician reports that he or she has a patient taking drug Y who experiences adverse event but refuses to provide any specifics about patients, the reporter is still a valid case even throughout the patient is not specifically identified. This because the reporter has first-hand information about the patient and is identifiable real person to the physician. The identifiable is important so as not only to prevent duplicate reporting of the same case, but also to perform it follow up for additional information. The concept of identifiability also applies to the other three elements. Although uncommon, it is not unheard of for frictious adverse event cases to be reported to a company by an anonymous individual or on behalf of anonymous patient distributed employees or former employees trying to damage the company's reputations or company's product. In this and all other situations, the sources of the report should be accelerated if possible, but anonymous reporting is also important as whistleblower protection is not granted in all countries. In general, the drug must also be specifically named. Note that in different countries and regions of the world, drugs are sold under various trade names. In addition, there are a large number of generics which may be mistaken for the trade product. Finally, there is the problem of counterfeit drug producing adverse event. If at all possible, it is best to try obtain the sample which includes the adverse event and send it either to European Medicine Agency FDA or other government agencies responsible for investigating adverse event reports. A report can recall the name of the drug they were taking when they experienced an adverse event. This would not be a valid case. This concept also applies to adverse events if a patient states that they experienced symptoms but cannot be more specific, such as report might technically be considered valid but will be of very limited value to the pharmacovigilance department of the company or to drug regulatory authorities. The activity that is most commonly associated with pharmacovigilance and which consumes a significant number of resources for which regulatory authorities and drug safety departments in pharmaceutical companies is that of adverse event reporting. Adverse event reporting involves the accept, tries, data entry, assessment, distribution, reporting, and achieving of adverse event data and documentation. The source of adverse event reports may include spontaneous reports from healthcare professionals or patient solicited reports from patient support programs, reports from clinical or post-marketing studies, report from literature, sources of reports from the media including social media and websites, and reports reported to drug regulatory authorities themselves or pharmaceutical companies. Adverse event reporting is a regulatory requirement in most countries. Adverse event reporting also provides data to these companies and drug regulatory authorities that play a key role in assessing the risk benefits profile of the given drug. Thank you.